pause for a moment and stay with me. Today's video is about the warning signs of lung cancer, and the clock is not on our side. By the time you reach the end of this clip, 3 lives will be lost to this disease. That is 1 death every 3 minutes, quicker than it takes to brew your morning coffee. Here is the part most people never hear. Many of those losses could be avoided when the early clues are recognized and acted on. If you have just found our channel, consider this your invitation to a community that fights for better health through knowledge. Your well-being matters here. Tap. Like if you are ready to learn something that could change your path, and subscribe so you do not miss information that can genuinely make a difference. Tell us where you are watching from in the comments. Hearing from our global audience helps us design content that saves lives in every corner of the world. And pay attention to your own body right now. That cough you have brushed off for weeks, the slight shortness of breath when you take the stairs, the lingering fatigue you keep blaming on stress may be your first alert. Today you will learn how to listen to those signals before they turn into something far more dangerous. What you are feeling could be your body's urgent bid to protect you. Lung cancer is a master of disguise. It rarely arrives with dramatic, obvious alarms. Instead, it murmurs through everyday complaints that look harmless. A cough that lingers gets chalked up to seasonal allergies. Unusual fatigue is blamed on a packed schedule. A faint ache in the chest is dismissed as a strained muscle. All the while, this quiet threat advances day after day. Here is the stark life or death reality that changes everything. When lung cancer is found, early survival rates climb above 60%. When those first clues are overlooked, that figure can plunge to around 6%. The line between a second chance and a devastating outcome often depends on recognizing 12 specific warning messages your body sends. Today we are unveiling those 12 evidence-backed symptoms that everyone needs to recognize. Some may catch you off guard, others may feel uncomfortably familiar. Each one could be the key to identifying this silent killer before it takes control. What you absorb in the next few minutes could genuinely determine the future for you or someone you care about. 1. Neurological symptoms. National Cancer Institute data indicate that brain metastases develop in roughly 20 to 25% of people with lung cancer, producing signs that are easily mistaken for unrelated issues. The exact symptoms depend on where the metastases land in the brain. Headache is a common early clue, but not the typical tension type. These headaches are often worse in the morning, can intensify with coughing, or when bending forward and respond poorly to standard pain relievers. Other manifestations include seizures, problems with balance, dizziness, clumsiness, or coordination. Difficulties, shifts in personality memory, lapses or episodes of confusion. These changes often unfold slowly, which makes them easy to shrug off until they start to disrupt daily life. The progression can be subtle. At first, you might find yourself blanking on familiar names, struggling to retrieve simple words, or having brief periods of disorientation that seem to clear on their own. When neurological symptoms follow this pattern, persistent, progressively intrusive, and resistant to usual remedies, they warrant prompt evaluation to determine whether brain involvement is present. 2. Swelling in the face or neck. As reported in the Journal of Clinical Oncology, this pattern, often called superior vena cava syndrome, develops when a tumor compresses the large vein that returns blood from the head, neck, and upper chest to the heart. The pressure creates a backup, so fluid accumulates in the upper body and the classic swelling appears. Many people notice it first thing in the morning because lying flat overnight can worsen the obstruction. Early on, it may look like mild puffiness around the eyes or a fuller face, but the swelling typically becomes more obvious as the compression intensifies. Additional clues can include trouble swallowing, changes in the voice, and a sensation of pressure in the head. The skin may take on a reddish or purplish hue, and the veins across the neck and upper chest can stand out as the body attempts to reroute blood through smaller vessels. This sign usually indicates that the cancer is sizable or positioned close to major blood pathways and requires urgent evaluation. 3. Bone pain. Data from MD Anderson Cancer Center show that bone spread occurs in roughly 30 to 40% of advanced lung cancer cases, most often in the spine, ribs, pelvis, and long bones of the arms and legs. When cancer reaches the skeleton, it signals a more advanced stage of disease. The pain it causes is typically deep, steady, and relentless, unlike arthritis, which flares with movement and eases at rest. It may begin as a nagging ache and progress to severe discomfort that disrupts sleep and daily routines. Any part of the skeleton can be involved. Tumor deposits in the spine may cause back pain that shoots down into the legs. Rib involvement can feel like chest pain that worsens with breathing. Disease affecting the hips or leg bones can lead to limping and increasing difficulty walking. When bone pain takes on this persistent, penetrating character, particularly in the typical locations, it warrants prompt imaging and assessment to identify or rule out metastatic spread. 4. Wheezing. Studies in the Annals of Internal Medicine indicate that the sudden appearance of wheezing in adults, especially those over 40, can be an early clue to lung cancer. The physiology is straightforward. A growing tumor can narrow the airways, forcing air through tighter passages and generating the familiar high-pitched whistle. Unlike asthma, which usually affects both lungs, cancer-related wheezing often shows up on just one side of the chest. This is easy to misread. Many adults develop respiratory complaints with age, so a new wheeze can be mistaken for ordinary wear and tear. But cancer-linked wheezing has signature features. It may be most obvious in certain positions or during specific activities. It often fails to improve with standard asthma inhalers, and it tends to intensify over time. In contrast to allergy-driven wheezing that flares with triggers and then settles down, the wheeze caused by an obstructing lesion becomes more constant and more intrusive. When a new wheeze appears in midlife, especially if it is unilateral, resistant to usual medications, and steadily worsening, it should prompt a thorough evaluation to rule out an underlying airway blockage. 5. Frequent lung infections. Repeated bouts of pneumonia or bronchitis can signal an underlying problem, and the American Lung Association notes that this pattern may be an early clue to lung cancer, especially when the infections keep appearing in the same region of the lung. Tumors can narrow or block airways, leaving behind stagnant pockets where mucus accumulates. Those poorly drained areas become ideal environments for bacteria to grow, making infections more likely to take hold again and again. The tissue around a tumor is also more vulnerable. Inflammation and structural damage reduce local defenses, so bacteria can invade more easily and repeatedly, often in the exact same spot. The result is a cycle of illness that seems to resolve and then returns, sometimes with increasing frequency. What makes this particularly hazardous is how easily the true cause can be missed. Attention often centers on clearing the infection rather than asking why it keeps recurring. Patients may go through multiple courses of antibiotics and feel brief improvement only to relapse because the obstructing tumor remains. This threat and relapse loop can persist for months or even years before the underlying blockage is identified. Recognizing the recurrence pattern, especially infections that recur in one lung area, should prompt a deeper investigation rather than routine repetition of antibiotics. 6. Coughing up blood. Cleveland Clinic data suggests that about 1/4 of people with lung cancer notice blood in their sputum, from faint streaks to more obvious quantities. No amount is trivial or safe to ignore. The blood may show up as bright red lines, rust-colored flecks, or a pink tint to the mucus. Some describe coughing up small clots, and others first see blood-tinged saliva upon waking. The underlying reason is bleeding from within the lungs, as tumor growth disrupts nearby blood vessels and mixes with airway secretions. As tumors enlarge, they can erode fragile vessels, while local irritation and inflammation make the vessel walls more likely to leak or break. Importantly, the volume of blood does not reliably reflect how advanced the disease is. Even minimal bleeding can signal a serious problem that warrants urgent medical assessment. If you notice any blood in your cough, treat it as a critical warning and seek prompt evaluation. 7. Fatigue. According to the National Comprehensive Cancer Network, fatigue tied to cancer affects up to 95% of people with lung cancer. This is not ordinary tiredness. It is a profound whole body exhaustion that does not lift with sleep or a weekend of rest. Several processes make it different from everyday fatigue. Tumor cells hijack the body's energy supply, pulling calories and nutrients away from healthy tissues, so routine functions are underfueled. Lung cancer can also lead to anemia by disrupting red blood cell production, which lowers oxygen delivery to organs and muscles, and deepens the sense of weariness. The pattern is often erratic. Taney describes stretches of near-normal energy, followed by sudden crushing crashes that force them to stop what they are doing. Just as concerning is the impact on mental clarity. People report brain fog, slower thinking, and trouble focusing, so reading a page following a conversation or managing simple tasks can feel overwhelming. When exhaustion is this intense, unpredictable, and unresponsive to rest, especially alongside signs like anemia or weight loss, it signals more than a busy schedule. It is a warning that deserves medical evaluation. Recognizing this type of fatigue early can help prompt timely testing and care. 8. Unexplained weight loss. A sudden drop on the scale can feel like a win for anyone who has struggled with weight, but appearances can be misleading. Research from Cancer Research UK indicates that about 60% of people with lung cancer lose more than 5% of their body weight within 6 months without trying. This shift is not the result of better eating habits or extra workouts. It reflects the body's reaction to the tumor's intense energy demands. Cancer cells consume large amounts of fuel, diverting nutrients away from normal tissues. At the same time, lung cancer can release factors that disrupt normal metabolism, pushing the body to burn calories faster than usual, even while resting. The change often unfolds quickly and without a clear reason. People notice jeans hanging looser belts, needing extra holes, or loved ones remarking that they look thinner. Appetite commonly wanes, and taste may seem different or dull, which further reduces intake. Together, these effects create a downward spiral that can erode strength and overall health in a short time. When weight slips away unexpectedly and cannot be explained by lifestyle changes, especially alongside poor appetite or altered taste, it is an important signal to take seriously and get evaluated promptly. 9. Hoarseness or voice changes. A shifting voice can feel unrelated to the lungs. Yet the Journal of Thoracic Oncology reports that roughly 18% of people with lung cancer develop hoarseness. Biology explains why tumors in the chest can press on the recurrent laryngeal nerve, the cable that powers your vocal cords, producing a voice that sounds hoarse, breathy, raspy, or unusually weak. The danger is in the easy excuses many chalk it up to seasonal allergies, acid reflux, or simply talking too much. They try tea lozenges or strict voice rest and expect improvement, but cancer-related hoarseness tends to linger despite those efforts. This warning sign can appear months before any other symptoms surface. Patients often say their voice sounds off or not like their own, even if friends or family do not notice at first. As the tumor enlarges and the pressure on the nerve increases, the problem typically becomes more obvious, with hoarseness deepening, and in some cases, progressing toward near total voice loss. When a new change in voice persists, resists common remedies, and has no clear explanation, it deserves prompt medical evaluation. Recognizing this pattern early can be pivotal in identifying lung cancer before it advances. 10. Chest pain. Set aside the dramatic crushing chest pain you see portrayed on screen. As the National Cancer Institute notes, chest discomfort tied to lung cancer is more often a dull, aching sensation that can be mistaken for sore muscles or reflux. That subtlety is exactly why it slips under the radar. This pain has telltale behaviors. It often intensifies when you take a deep breath, cough, or laugh. What might begin as an occasional twinge can slowly turn into a steady presence, frequently concentrated on the side of the chest, closest to the tumor. For some, the pain arrives as sudden stabbing jabs that come and go without warning. For others, it feels like a persistent gnawing ache that never fully lets up. It can spread to the shoulder arm or back, easily passing for arthritis or a strained muscle. The reason is anatomical. As tumors enlarge, they can press on nerves, the ribs, or other structures within the chest cavity, producing referred pain along those pathways. As the disease advances or involves nearby tissues, the discomfort typically escalates. Nights become harder, sleep is disrupted, and normal routines start to feel overwhelming. When chest pain follows this pattern worse, with breathing or coughing focused on one side radiating to nearby regions, and increasingly constant, it deserves prompt medical attention rather than self-diagnosis or delay. Early recognition of these nuances can profoundly affect outcomes. 11. Shortness of breath. Mayo Clinic findings from 2023 indicate that roughly 60% of people with lung cancer report breathing difficulty, yet it is among the most misread symptoms. Its danger lies in how quietly it develops. You do not awaken one morning gasping for air. Instead, the change is so gradual that many people unknowingly reshape their routines around it. At first, you feel winded only during hard workouts. Soon, everyday tasks leave you huffing. Eventually, the sensation can appear even while sitting still. Inside the body, the mechanics are alarming. Tumors can narrow or block the airways, and fluid can collect around the lungs, combining to restrict airflow and compress normal breathing. Patients often describe it as trying to inhale through a narrow straw, or as if a weight is pressing on the chest. Walking to the mailbox, climbing a short flight of stairs, or lifting a grocery bag can feel disproportionately draining. The heartbreaking part is how easily this symptom gets rationalized as aging deconditioning or a lack of fitness. In reality, those quiet adjustments can mask a serious process that needs attention. When shortness of breath creeps from exertion to daily activities, and then to rest, that progression is a significant warning pattern. Recognizing it early and seeking evaluation can change the trajectory of the disease. 12. Persistent cough. The most dangerous sign of lung cancer is often the one people overlook. American Cancer Society data from 2023 indicates that as many as 75% of patients report a cough at the time of diagnosis, yet many ignore it for months or even years. This is not the usual cough from a cold or allergies. It often begins as a dry hacking irritation that does not improve with lozenges, honey, or common over-the-counter remedies. Its danger lies in how convincingly it imitates routine respiratory problems, prompting delays in getting evaluated until the disease has advanced. Another hallmark is timing and persistence. The cough frequently intensifies at night, fragmenting sleep and gradually draining the body's resilience. While a typical cough settles within 2 to 3 weeks, a cough linked to lung cancer lingers for months. It may seem to ease for a short period only to return with greater force, creating a false sense of recovery before worsening again. That cycle of brief improvement followed by escalation is a critical warning signal. If you recognize this pattern, especially in a cough that refuses to resolve or keeps you up at night, it calls for prompt medical assessment rather than watchful waiting. Early attention can make all the difference. In the fight against lung cancer, knowledge and prompt action are your strongest allies. If this video helped you, please type helpful in the comments, as that motivates us to create more content like this. Please like the video. If you found it valuable, share it with anyone who could benefit and subscribe to our channel for more health-related information that could save lives. Thank you for taking the time to learn these critical warning signs. And remember, when it comes to your health, it is always better to be safe than sorry.